Imagine walking into your medicine interview. You're given an ethics question. Then imagine that you aced that question, you were able to weigh up the different arguments, you understood the different principles, and you were able to talk about it in an understandable yet confident manner. If you want to be in this position, make sure you watch this video. In this video, we're going to be talking about key ethical principles, the 4 pillars, and also the idea of conflict of interest. This is going to give you a really strong foundation to be able to answer any ethics question that is thrown at you during your interviews. Hi, I'm Loveleen, a medical student at King's College London, here to help you with your interviews. Now, I completely understand how daunting and difficult interviews were, as I was in your position. But fast forward a couple of months, I went on to achieve all 4 of my offers with interview scores as high as 135 out of 140. And I'm here to help you do the same and achieve your dream of studying medicine. On my channel, I talk about all things relating to medicine, entrepreneurship, and mindset. Now, to help you, I've also created loads of different resources. First up is my Aspiring Medics newsletter for completely free resources. On this, I post loads of different tips relating to the journey of getting into medicine, especially around during UCAT season and interview season, and what you can be doing to help you achieve your dream of studying medicine. Additionally, one of the key reasons that I was actually able to get all 4 of my offers was my interview document. This is an over 50-page document in which I've included all of the content that you need to know, ethical pillars, over 100 different types of questions, and also the NHS hot topics and research. If you're interested in this, make sure to check it out using the link below. Additionally, if you want more personalized support with helping you get your 4 out of 4 offers and studying medicine at your dream uni, then check out my interview course. Again, as part of this interview course, you get personalized, tailored learning given to you about all the content, learning how you should actually be structuring your interview responses, what your interviewers want from you when you're doing a med school interview, and the art of speaking and presentation, because this is so important in helping you secure your offers and get into medicine. Let's start off by taking a look at the 4 pillars of medical ethics, as these are so important for every single ethics question that you will be answering, and you want to make sure that you're mentioning these. First is autonomy. What autonomy means is that every single patient has the right to make their own decisions. So even if a decision that a patient makes goes against what you believe is correct for them, you are not allowed to force any decisions upon for them. Your job as a healthcare professional is to provide patients with all of the information that they need so that they can make an informed decision into whatever choice that they want to make about their health. As long as a patient has the capacity to be able to make decisions, you allow them to do so. Even if a patient wants a second opinion or their opinion differs from yours, again, it's really important that you respect that patient's wishes. Next is the idea of beneficence. This is the idea of doing good. Any treatment that you give to a patient, you want to make sure that you're maximizing the benefits out of this, that you're supporting patients, and that they have good healthcare outcomes by the end of it. Here, you're trying to make sure that the benefits of something outweigh the risk. Then we have the principle of non-malificence. This is the idea of do no harm. This is really important because any treatment you give to a patient, you do not want to be causing them harm. However, it's really important to mention that the idea of beneficence and non-maleficence, they do go hand in hand. So let's take the example of someone needing a blood test. So the idea of actually taking a blood test from someone, technically it does go against non-maleficence because you're causing a patient harm. When you take a blood test, you feel the sharp prick of a needle and it hurts. Now that is causing harm to a patient. However, in order to value beneficence, essentially we're doing good in the long term, because by taking that blood test from a patient, you're able to essentially have an understanding about different levels of different substances in the blood. This is how you balance the 2 different ethical principles together. Overall, your aim is, considering these 2 principles, is that you're giving a patient the best care possible whilst minimizing any risks and harm and maximizing the benefits. And the final ethical pillar is the idea of justice. Now, when we say justice, this means treating all patients in an equal manner and doing everything in relation to the correct law. So any decisions that you make as a healthcare professional, they have to abide by the law and GMC guidelines. You should also make sure that you're treating all patients equally, as this is really important so no patient feels discriminated against. Another key idea of justice is that you value every patient's respect to confidentiality. Now, one key thing to mention is that in order to value the pillar of justice, there are 2 different ways of doing this. The first way is that you need to make sure you're respecting a patient confidentiality. However, if that patient is at risk of causing harm to others or to themselves, then in order to maintain justice for the general public, it may be necessary to break confidentiality here. It is dependent on the risk that that patient may have on themselves or others when deciding whether or not it is fair to break confidentiality. Now we're going to take a look at some medical ethical principles. Now I just want to highlight that these principles, they are not necessary for you to learn. However, having an understanding of these often shows a much more higher level ethics approach. And if you want to be able to show that, it's a good idea to make sure you understand these principles so that you can discuss the ideas from them in your interviews. Let's take a look at the ethical principle of deontology. This was developed by Immanuel Kant, and what deontology states is that actions are either right or wrong, and there's no grey area. It's either something is the right thing to do or something is the wrong thing to do. Now, some principles that we use in medicine are based on it. For example, the 4 ethical pillars that we've just looked at, or the GMC document. This is very much based on what is right and what is wrong. The next ethical principle is the idea of consequentialism, which was developed by Jeremy Bentham. This states that whatever you do, as long as the end result is okay, then the actions in between don't matter. Essentially, the end result is more important. Now, this is good in the sense that it prioritizes and brings back into medicine the human element. However, some criticism of this is that it's actually not opposing rule breaking. Next, let's take a look at the idea of dependency. This again is actually an important principle that can come up in your ethical scenarios. What dependency means is that if you're given an ethical scenario where typically the most common one is where you have to give an organ to one of 2 patients. Now, one patient may have dependence on them. What that means is someone who is dependent on that person in order to live their daily lifestyle. So for example, patient number 1 could have children, and those children are dependent on that patient in order to get to school, to be fed, and all of these different things. Dependency is an important principle that you need to consider in these ethical scenarios when deciding what to do. Utilitarianism is another principle which is important to know, and this is essentially knowing how to balance what are the negative and positive effects to come to an overall decision. This is often how resource allocation is conducted. The final ethical idea that we're going to be taking a look at is the idea of conflict of interest. Now, a conflict of interest may arise due to direct financial gains or even because of personal or professional gains or interests. Now, in order to stop this from happening, there are 3 guiding principles that you need to know about. The first is that you always should be prioritizing patient safety no matter what. If there is a situation where interests are being competed for, there is that conflict happening, always prioritize patient safety. The second is to make sure that you're never exploiting or using or abusing your position as a doctor or medical student for a financial gain in some way. And the third guiding principle states that you must always be open and honest about any conflict of interest that you may have. By doing this, it shows again you're maintaining that honesty, integrity, and professionalism, which are so important within the career. In the event where a conflict of interest does occur, what you need to do as a healthcare professional is first make sure that patient safety isn't being compromised in any way. Once you've identified that, second is to declare that or discuss that with a senior, or sometimes in legal requirements you may have to disclose this too. And thirdly, you have to be prepared to no longer treat that patient, for example, because of that conflict of interest, and be happy for another colleague to see that patient. I hope this video has been helpful to improve your understanding into the medical ethics and how you can actually answer and include more content into your ethical questions. I have a second video on ethics too, and also videos on all of the topics and content that you need to know for getting into medicine. So make sure to check out the rest of my videos on my channel.